So I will be presenting about the work Intellisoft is doing with large language models for patient education on our implementation, which is a hospital. So a hospital is Intellisoft's flagship product, an end-to-end HMIS powered by OpenMRS 3.4. So the problem we are aiming to solve is that patients leave clinical consultation with an incomplete understanding of their health condition, treatment plans, and any follow-up care that they were instructed during the visit. This is mostly due to the quick interaction that clinicians have with patients, maybe because of the long queues that they have to serve. Also, an incomplete understanding of patients' health literacy levels. Maybe you assume, clinicians sometimes assume the literacy levels of the patients, and sometimes patients during a clinical visit, maybe due to some anxiety, they don't even hear what the clinician is saying. So what we're aiming to do is leveraging large language models to summarize clinical encounters and generate layman understanding message that can then be shared to the patients using SMS. And with this, we hope that we are able to communicate clearly to the patients the clinical encounter, and this will ideally help them understand their health better and be more in control of their health, and also adherence to the treatment plans that they had, treatment plans and follow-up visits that they had been put on. I will jump straight onto a demo of what we have and kind of walk through the implementation. So it starts with the normal clinical workflow, where a clinician fills in sort of triage information, as well as clinical visits data. So I think I can just fast forward maybe this section. So just fills in triage. Then fills in the clinical information. Maybe does lab requests. As well as the medication or drug request. Great. I think this is the most interesting section then. So we added like a module on the side there we call iChat, which is the platform, or rather the interface where the clinician interacts with the large language model. And as you can see, then we have a patient encounter summary that will be sent to the model. Of note here is that we are sending only encounter the identified encounter details. So something like sex, vitals, diagnosis, tests, as well as medication. And then prompting the large language model to generate the patient-facing message. Then once we receive a message from the large language model, the clinician is forced to review the message and approve. So there's a button to approve. There's also ability to edit the generated message. And then once they edit and want to save, they are prompted to provide a reason for editing. This is what we are logging on the backend to govern, or rather to guide our future iterations of the module. We want to know the most common reasons for editing. I'll just go back a little bit. And then there's also an opportunity to regenerate a message. So this is the logged reason for editing. And then if the clinician is completely unsatisfied, they can regenerate the message with a prompt for their reason for regenerating. So we're logging both the reasons for editing, reasons for regeneration, and the message is regenerated. Clinician reviews, and they can approve this message for sending. So then this is the message that will be sent to the client, and they can send it by SMS. We also have a messages module where we are logging and showing to the clinicians or the users the messages that are the queue of messages that are being sent out, organized on a calendar or day-to-day basis. So on the LLM messages, we can see that our patient John Doe Njoroge received, or rather the message was sent successfully, and we can see the message details. Yeah. So that is our implementation for patient education. I will leave on the chat our community post where we go into detail on maybe the workflows, including consent and what have you. So in case I went too fast or you have any questions, please leave them on the chat. Thanks.